Morning guys, quick 1 minute video on tennis elbow. So tennis elbow is that condition you get when you get an aching down the back of the forearm. So typically it occurs when you're picking anything up from the top. So people say, well, you know, I just go and pick up a mug of tea, a cup of tea, and it aches, or I'm driving and it aches. So what's going on here? Well, when we look at the forearm, we've got muscles on the front here which grip, which are the flexor muscles, and we've got muscles at the back here which move the fingers open. And these two muscles, the muscle groups, the flexors and the extensors, work together as we grip. Now what tends to happen is, because we do a lot of gripping actions, the muscles at the front can sometimes get a little bit stronger than the muscles at the back. And so we end up with proportionally a weakness on the back of the forearm. So these forearm muscles come from the fingers and the wrist, and they all come into the bulk of the muscles here, and they attach into a very slim filament called a tendon, which comes onto a knobble of bone. And that is the area which tends to develop tennis elbow. So it's called the common extensor origin. It's common for all of these extensor muscles, so they all attach into that area. And what happens with tennis elbow is that you get something called a tendinopathy. And a tendinopathy can occur in various different areas of the body, in the Achilles, at the patella, in the shoulder, all sorts of different areas. And essentially the tissue changes. It becomes a little bit different, a little bit less flexible, slightly leathery, slightly stiff. And what we have to do with that initially, when it's irritating, when it's painful, is to try and take loading off that area. So we're going to do less. We're going to grip less. We're going to move the arm less. And we can change the way that we grip. So typically, if you're working, say, as an electrician or as a plumber, and you're using a lot of tools, you're gripping onto a handle of a screwdriver or a wrench which is quite small. Try putting a piece of foam rubber around the handle to make it a slightly fatter grip, or using a cycling glove to make it a slightly fatter grip. So changing the grip can be effective. If it's very painful, then you might just put something cold on that area. It's not inflamed, but the cold can sometimes help just to take the pain down. But I'm going to do that for a short while, because I said that one of the fundamental problems with this condition is that the muscles can be slightly weak. So as bizarre as it might seem, this type of condition, a tendinopathy, responds to selective loading. And what I mean by that is doing exercise to try to strengthen the muscle, to put load through the tendon to gradually get it to adapt. In the same way as if I said to you, well, we're going to go to a gym, we're going to lift a heavy weight, you might say, well, I'm going to gradually build up to that. And so with our tennis elbow, we're gradually going to build up the exercise. And what we want to do is to re-strengthen the forearm muscles once we've got over that initial period where it's irritated and painful. So as the pain starts to subside, we're gradually going to start re-strengthening that forearm muscle. And what we'll do in a future video is we'll have a look at muscles to stretch the area, exercises to stretch the area, which can sometimes be a little bit pain relieving, and exercises to strengthen the area to try and get that loading through the tendon. Alright, so tennis elbow then, related to the muscles on the forearm, although the pain can sometimes shoot right down the forearm, often associated with this area called the common extensor origin, which attaches onto this knobble of bone. Alright, thanks very much for watching, in fact, and have a good day.